The rate of malaria has seen a significant reduction in the last 20 years, but it remains the second biggest killer in the country after pneumonia. The drop in malaria figures has been due to awareness, ongoing prevention efforts and a major shift in drug treatment.
Well, in the 1970s, malaria was...
Professor Ivo Mueller from the PNG Institute of Medical Research has seen how the malaria parasite has become resistant to drugs over 10 years and how anti-malarial treatment strategies have evolved in Papua New Guinea.
As early as 1990, the drugs weren't working any longer. But it took 10 years to shift the treatment, and we don't know how many people died in the 1990s because we treated them with drugs that weren't working. Then in 2000 we made the first change to add another drug to chloroquine, which was SP, sulfadoxine pyrimethamine. But that only was really a stopgap. And now we have changed to a new category of drug, which we call artemisinin combination treatments, which are highly effective and work very, very fast.
Malaria is spread by a certain type of mosquito that carries parasites. The common symptoms are fever, joint pains and nausea. At Lays Angau Hospital, many of the patients who come here have malaria. Staff have also noted what appears to be a slight drop in the number of men, women and children seeking treatment. Last year, Angau reported that 3 out of every 10 people admitted were suffering from malaria, and 6 out of every 10 deaths were malaria-related. Morobe Governor Kelly Naru says more money has to be put into malaria research.
Employers, whether in the public sector or private sector, cannot afford to have workers taking time off sick due to malaria attacks too frequently.
The director of the PNG Institute of Medical Research, Professor Peter Siba, meanwhile says the government should not lose sight of the other big killers.
Malaria is also important, but you got other diseases. Like malaria is number 2. The main killer out there is pneumonia. Killer of many of our young children out there.
Over the next 2 days, the symposium will examine all the data available for malaria as well as a possible vaccine to be used in Papua New Guinea. The resolutions will be adopted by government and implemented over the next 12 months. Scott Waide, National MTV News, Lae.